The Concussion Clinic is a program that was started by a collaborative group of professionals to focus on evidence-based care, finding answers to important questions, focusing on providing personalized medicine to individuals who have had a sport-related concussion throughout their life.
I was at the top of the ski course and we decided this was going to be our last run of the day. And I was racing against a skier that was much, much better than I was. And I really wanted to beat him to kind of prove myself. And so I started out strong, and then he overtook me and I caught a lip and I fell. My parents would always ask me on a scale of 1 to 10, how bad is your headache right now? And I'd always think of 10 as being in the helicopter, what that was like, and it was just horrible.
It was the beginning of November in the Massachusetts State Tournament, and I had the puck and I got hit from behind into the boards.
A forward was pinching in on him. He curled back, and as he curled, he got hit from behind directly into the boards. I knew it was a pretty bad hit. It was a big kid. He hit him pretty good. He went down. He got up on one knee, stayed down for about 30 seconds, then eventually was able to skate off the ice on his own with the help of one of his teammates. As he walked to the locker room, I asked him if he was okay, and he says, "No, I'm not. I'm seeing double."
We were first introduced to the folks at the Concussion Clinic when Lily returned home in early April.
I really love basically navigating the concussion recovery phase for families and patients.
Specifically Don O'Connor, who was so helpful to our family. Healthcare in general is somewhat nameless and faceless. As large hospitals grow, you don't exactly know who you're going to be speaking with or getting a phone call return. Having an ally in somebody like Don, who not only helped Lily, but helped her mom and dad get through this incredibly challenging time, was such a godsend. During a time when you come to such a incredible institution like MGH, it can be intimidating. But to have actually a phone number to call, and more importantly, have your phone call returned in a timely manner, meant the world to us.
Basically, it starts right at the very beginning, because there's a lot of anxiety, a lot of questions that people have, especially when someone gets concussed at a young age or with a sport. And so I love basically getting involved from the moment that they are at clinic, and mostly just to alleviate their fears. I do call every patient that's new, and basically I find that's a really great way for me to get in touch with the patient, answer those questions before they come to clinic.
Both concussions, I've seen Dr. Panis, and he's the man. He's awesome.
When you have a concussion, you look okay. You know, it's not something that you can see on someone's face. So one of our challenges has been to try to work with schools, get them to understand a bit of what the issues are, trying to give accommodations to kids that allow them to continue to progress in their schooling in spite of their problems, impairments, giving them accommodations in terms of school to let them continue, whether those accommodations be a longer time to take an examination, one examination a day, being able to go to the nurse for some Tylenol.
So I think one of the most challenging things as a parent was that Lily was in an environment that was not as well as informed as certainly along the halls of MGH. And her instructors and her teachers looked at her thinking, well, you look fine, you must be fine, pick yourself up and get back out there. You saw Dr. Panis, I think, every 2 weeks or so, and she visited with Lenore Herget, and your physical therapy once, how much?
Every week.
My name is Lenore Herget. I'm a physical therapist over at the Sports Medicine Complex right next door. I specialize in treating athletes with post-concussion syndrome, in addition to treating orthopedic patients as well. I've recently been involved with the Youth Concussion Clinic here over the past year, and I treat kids anywhere from age 9 right up through college and professional athletes.
As a neurologist, for a long time, I always saw concussions. We always saw concussions in kids, and I saw concussions in injured workers. But it's over the last couple of years where concussion has become much more of a public issue, and that the people here at MassGeneral Hospital for Children, in cooperation with departments of physical medicine and rehabilitation, neurosurgery, psychiatry, pediatrics, pediatric neurology, felt that there was a need for a very specific clinic devoted to sports concussion in kids.
This is a program that truly meets a public need at a time when we're encouraging as much as we can for children and young adults to engage in physical activity. We are working together with the Spalding Rehab Hospital and our colleagues in neurology, child psychiatry, and other specialties, be able to provide the full spectrum of care that any child who sustains a head injury could possibly need.
I love watching him play. I love it. I enjoy watching him. I'll miss it as much as he does. But ultimately, as a parent, you have to make these decisions that, for the long term, what is going to be best for him. And I don't want to take a chance. It's not worth it to me that to him have any type of permanent injury from this.
We cannot make it the responsibility of the athlete to decide whether or not they should play or not. I think that's one of the areas that parents will struggle. They don't want to impose something on their children, and they know that their children so want to play.
It's only through research that we're going to begin to understand the difference in this growing phenomenon of sport-related concussion. Clearly, sports are tremendous value to our children, to our grandchildren. But we've got to understand who is most vulnerable. What are the factors that make them vulnerable? How can we help prevent some of these injuries? And when they occur, what do we do to treat them, and how do we treat them safely?
We feel that being in a more normal situation, school, as opposed to staying home, is much better for a kid. Even if they have lots of symptoms and only can last at school half a day, we think that's better for them.
My main focus with them is to look for any lingering symptoms like visual disturbances, blurry vision, or double images, or words jumping off the page or screen when they're reading in school. Anything from that to dizziness when they're moving their head, or dizziness when they try running or exercising, and of course orthopedic issues, so if there's any neck pain as well. We start with trying to fix those systems and then eventually getting the athlete on a program to safely return to their sport.
One of the things that I've done over the years with athletes is help them not only perform well, because I think that's one of the reasons why a lot of athletes will come in, but they also want to recover from an injury, whether it's a shoulder injury or a leg injury, and in this case, a concussion. And so when we started this clinic working with concussions, it was sort of a natural fit to have a psychologist helping athletes recover and families manage that. So this presentation is an educational session about concussion, but it's also a little bit about how do you deal with it and some of the things to start thinking about as you recover.
Most of these patients get better in a couple of weeks, and those are the people that I can manage pretty well. On the other hand, if they are still having symptoms after 2 weeks or so, having the concussion clinic is really critical for me, because I think those children need further evaluation and possibly treatment.
We have wonderful imaging technology here at Mass General and the Martinos Center. And in my laboratory, we study the effect of injury on the brain as a function of how mature your brain is when it's injured. We think this makes a major difference. We are also studying the genetics of injury. That is, you may respond differently than you might because your genes are different. We think that differences in your genes may affect how your brain repairs and how it recovers.
First of all, the vast majority of people get better anyway, no matter what happens. But in some children and in some adults, the symptoms persist. And then the issue becomes, what's the best thing for them in terms of cognitive activity as well as physical activity?
We can't see it in CT scans or MRIs. There's no bruise or bleed. It's not like you wear a bandage on your head and everyone knows you've got a concussion. In fact, they look at you and you look fine. It's kind of an invisible injury, and it's hard to detect, and you can only detect it by your story and by your symptoms.
It probably feels like it's continuous, but most of our patients, if not all, do recover. I love to say it's nothing scary. There's no needles, there's no blood, there's no shots, and basically you're going to come in and be taken care of and have a lot of your questions answered.
The athlete gets the best of all worlds. So instead of seeing just a neurologist or just a psychiatrist or psychologist or just a physical therapist, they get to see everybody in one setting. And that's what makes it work and makes someone get better faster.
Research in this area is critically important. In spite of all the attention that's been paid to concussions, there is still a huge amount that we don't know about the mechanisms of concussion, what goes on in the brain biochemically.
How do we prevent the long-term problems? Investigators at MassGeneral Hospital are really working out all of those issues, and they're doing it in collaboration with investigators throughout the country. Our unique focus has been understanding the biology of this process and the risk factors associating with it, and better coming to grips about how we can measure the injury and then treat it. I'm confident that the next years will bring exciting new revelations to treatment and to an understanding of the process.
Right now, our biggest need is manpower, so funding to pay for people to gather this data and to enter it into databases, to make sure that every child whose family is willing gets entered into the database. That's our most pressing need.
I think that this clinic is just a phenomenal clinic. It puts you at ease as a parent, and it helps the child in the recovery process. It makes him understand what he has to do, and the staff here has been absolutely great. Donna O'Connor, I can't say enough what she's done personally in regards to helping with my insurance issues, as well as setting up scheduling with me that works for both my son and I, sending letters to the school when we need them. It's been very, very, very good.
This program was made available through the generosity of Jim and Lisa Mooney, who understood how valuable it is to parents to be able to pull all of these services together in one place and to be reassured that their children are going to be well cared for and resume their normal lives as soon as possible.
Our mission is to try to understand this growing phenomena, bring to bear science, and add in our personal caring for each one of these young people. It's much more for us about each young athlete than it is a conveyor-based process. So I hope that the next many years will bring enhanced care, improved discovery, and the next generation of treatment.